Support international efforts to develop a vaccine, expand treatment, expand testing, and ensure that critical medical supplies get to the front lines. As I've said before, this is a global crisis, and it demands a global response. While we're doing everything to keep people safe in our respective countries, we also have to help more vulnerable nations fight this virus by providing more support for their healthcare systems, debt relief, and other forms of assistance. We will keep working together as partners to ensure the safety and health of people around the world. Au cours des dernières semaines, notre gouvernement a présenté
our government has introduced a series of measures to help people get through these difficult times because of the pandemic. With the emergency wage subsidy, we are allowing more people to continue to receive a wage, even if the company they work for has had to slow down or completely shut down its activities. With the Canada Emergency Response Benefit, we are giving $2,000 a month to people who are unable to earn a living because of the virus. And yesterday, we announced that we would be relaxing the eligibility criteria to allow more people to receive the help that they need. If you're a seasonal worker, or if you earn less than $1,000 per month, or you recently exhausted your employment insurance benefits, the emergency response benefit will be there for you. At the same time, we are working with the provinces and territories to top up the wages of essential workers who earn less than $2,500 a month. Caregivers and nursing assistants and others who are working hard to maintain a semblance of normality and who are doing an extraordinary work can be helped. They deserve not only our recognition and our gratitude, but our support. Tonight, I will be discussing that with my colleagues from the provinces and territories at our weekly meeting. And we will also be talking about how we can better protect our seniors who are in seniors' residences or in long-term care facilities. Last night, the Minister of Public Health and Public Safety, Bill Blair, received an official request from the government of Quebec to lend a hand to healthcare workers. We are working closely with Quebec to finalize an assistance plan, and we will have more news to share with you soon. But I can tell you now that we will be giving them every possible form of assistance, including the Canadian Red Cross, the armed forces, and specialized volunteers who have registered with Health Canada. We will always be there for Canadians in difficulty. Another issue that often comes up at our weekly meetings with the premiers is the supply of medical equipment. I can confirm this morning that the government has finalized contracts with a number of Canadian businesses, including Geometric Energy Corporation of Calgary, which will be providing millions of gloves to our healthcare workers. And later today, Minister Akin will provide an update with respect to recent developments when it comes to supplies.
Over the past few weeks, we've rolled out a series of measures to get people the help they need as quickly as possible. As things evolve, we're hearing from Canadians who need more help, from businesses who need more support. No one should feel as if they're alone in this fight. Our government is here to help you through these challenging times. So when we hear the program is not reaching as many people as it should, we make changes. A few weeks ago, we launched the Canada Emergency Business Account to help small businesses struggling with cash flow. Under this program, banks are offering $40,000 loans, which are guaranteed by the government. To date, more than 195,000 loans have been approved. We're talking about more than $7.5 billion in credit to small and medium-sized businesses. It's a start. But Minister Ng and others have heard from business owners who could really use this help, but who do not fit the current admissibility criteria. So we're going to make some adjustments because we want to be there to support you. Today, we are expanding the Canada Emergency Business Account by both increasing and decreasing the eligibility threshold. Now, businesses who spend between $20,000, who spent between $20,000 and $1.5 million in total payroll in 2019 will be eligible to receive a loan through the CEBA. That's businesses who spent between $20,000 and $1.5 million in total payroll in 2019 who will now be eligible. This is money entrepreneurs and employers can use to cover operational costs and help with other immediate needs. Businesses and commercial property owners are also facing specific challenges because of COVID-19, so we plan on introducing the Canada Emergency Commercial Rent Assistance. This program will provide support to help small businesses with their rent for the months of April, May, and June. To implement this program, we have to work with the provinces and territories as they govern rental relationships, and we hope to have more details to share very soon.
A few weeks ago, we introduced the Emergency Business Account. Under this program, the banks can offer guaranteed loans of $40,000 to eligible companies to help them with their cash flow. Up until now, more than 195,000 loans have been approved. We're talking about more than $7.5 billion in credit for small and medium-sized companies. That is a start, but Minister Ng and others have been talking to a number of employers who need that financial assistance but are not currently eligible to the for the program. So today, we are expanding the business account by increasing and lowering the eligibility thresholds. Now, companies that have spent between $20,000 and $1.5 million in payroll in 2019 can apply to receive a guaranteed loan. This is funding that entrepreneurs and employers will be able to use to meet their cash flow requirements and pay other expenses. Furthermore, businesses and commercial building owners are facing particular problems because of COVID-19. Our government has therefore decided to introduce the Canada Emergency Commercial Rent Assistance. This measure will provide support for small businesses to help them pay their rent in the months of April, May, and June. To implement that program, we will have to cooperate with the provinces and territories because they are responsible for everything relating to rent, and we hope to have more details to share soon.
We've all had to get used to this new normal. It's been snowing in some places this week, including here in Ottawa, because that's just what 2020 brings. But we hope that the weather will get nicer. As time goes on, staying home and not seeing friends is going to be even more difficult. We're going to miss our colleagues, our friends, our neighbors, and our parents even more than we do now. But we have to be disciplined. We must stay the course. We cannot let the progress we've made go to waste. And above all, we cannot put lives at risk. So let's keep following public health recommendations. Wash your hands. Stay home as much as possible. And if you do go out, be sure to stay at least 2 meters away from others. If we persist and persevere, I know that we will prevail. Once again, thank you all for joining us. I'm now happy to take questions.
Thank you, Prime Minister. We'll now go to the phone lines for some questions. Just one question, one follow-up. Operator.
Thank you. Merci. The first question, la première question, l'inaudible, la presse canadienne. À vous.
Oui, bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. With respect to the request from Quebec for assistance, you talked about the Army and the Red Cross. Now, have you made a commitment to send the military in, to send in the Red Cross to help Quebec? Well, Quebec has already given us 2 requests for assistance that we were able to respond to immediately with the Rangers in Inuvik and the Lower North Shore. Yesterday, we received a 3rd request for help, which we're looking at because it's a bit different from what is normally asked of the CAF. So right now, we're looking at this and trying to see how we can help Quebec during these difficult times. And of course, I realize that people are worried for the health of their parents and other seniors who are in these seniors' homes and other facilities. And we know that we have to find other ways to help, and we will be there to help. But we will need to discuss this with Quebec to see exactly how we can support them and respond to this request, which is not the usual type of request. Of course, this is not a usual situation either. Are you saying it's not usual because we're talking about help in long-term care facilities? Yes. Partly it is for medical help or people with medical training. And of course, we do have doctors in the Canadian Armed Forces, but not that many. So we're looking at how we can help. And these are discussions that are ongoing. Of course, when there's flooding, the armed forces are there to help out, and they've been trained to provide support in that kind of situation. Now, this is a new situation, so we are talking to Quebec about this to try and figure out how we can support them. But we will be there to help, and we know how important it is.
Merci. Prochaine question. Moderator.
Thank you. Merci. Prochaine question, Émilie Bergeron, Agence QMI. À vous.
Good morning, Mr. Trudeau. Could you be more specific about the request from Quebec? Are we talking about help in long-term care facilities? Well, this is a request for assistance we received yesterday from Quebec, and we are looking at it and working with Quebec to see how we can provide that kind of help in seniors' homes and long-term care facilities. We're reviewing this and seeing what exactly we can do, and we will continue to work with Quebec to provide that support. We know how important it is, and we will be there to help. Okay. And my follow-up question? What is going to happen on Monday? The House of Commons is scheduled to start up again on Monday. If there is no agreement with the Conservatives, what exactly is going to happen? Well, obviously, there's nothing to worry about. We have a healthy democracy, and our institutions have to continue to work, not in spite of the crisis, but because of the crisis. So we are currently discussing the situation with the opposition parties to try and find a way to continue to do the important work that is done by our institutions. And at the same time, we are following the recommendations and advice of our public health authorities. So we are going to be concluding those discussions very soon, and I expect to be able to provide details as to how the House of Commons will operate in the coming weeks very soon.
Thank you. Merci. Next question, Ryan Tumulty, National Post. Line open.
Yeah, good morning, Prime Minister. I'm wondering, when you're meeting with the premiers today, are you going to discuss how to phase and reopen the economy? I'm wondering if you're at all concerned that the possibility that some provinces that are doing better may reopen before other provinces, creating a strain there.
I think one of the things we've seen across the country from leaders and from citizens is a desire to know when this is going to be over, how soon we're going to be able to start getting back to normal life. But I think everyone understands that until we have a vaccine, until we are in a place where there is proper treatment, there is a massive amount of testing, we are not going to be able to talk about getting back to normal. We will, hopefully, in the coming time, be able to loosen certain restrictions. But our health professionals and experts and all leaders understand that that has to be done at the right moment and very, very carefully. It would be absolutely disastrous for us to open up too early or too quickly and have another wave hit us that could be just as bad as this one, and find ourselves in a situation of having to go back into quarantine the way we are right now, and have everything that we've done these past weeks be for nothing. We know that there are lots of conversations to be had about how we reopen our economy, what happens in the right order, what the sequencing is, how we keep people safe. But we're a long way from having the ability to start doing that. Of course, conversations are ongoing now, but we're still many weeks away from talking about actually doing anything to reopen our economy, even with the variations across the country of the local state of the pandemic.
Follow-up, Brian?
Yeah, and then in terms of that discussion, do you envision that it will be based on metrics? Will it be based on the number of new cases, say, or some sort of metrics-based approach to making that decision, I guess?
I think looking at where we are on the curve, the number of new cases, the decline in cases will be an important piece of it. But I think what's even more important is the measures that we will have in place to be vigilant, to respond if and when there are resurgences of the virus in local pockets, in particular areas. We're going to need to be extremely vigilant, extremely prepared to respond quickly with massive testing, with contact tracing, with measures that people will be able to kick in very quickly if that comes. I don't think we can talk about reopening things until we are confident that we have exactly the plan on responding to future resurgences in place, and that's a lot of what the conversations are going on right now.
Thank you. Next question, operator.
Thank you. Merci. Next question, David Engren, Reuters. Line open.
Yeah, good morning, Prime Minister. On your G7 call, what, if anything, did other leaders say to President Trump about his decision to suspend funding for the World Health Organization?
I think we all recognize on the call how important it is to continue to coordinate and collaborate the science around the pandemic, to work on public health measures around the world, to share information around vaccine development, around treatments that can work. There is a need for international coordination, and the WHO is an important part of that collaboration and coordination. We recognize that there have been questions asked, but at the same time, it is really important that we stay coordinated as we move through this. That's certainly what Canada is going to do.
And secondly, President Trump yesterday suggested that the border with Canada, the restrictions could be loosened. Are there any such plans from your point of view?
I think there was a recognition by the president, as I've highlighted many times, that the closeness, the collaboration, the friendship between Canada and the United States is quite unlike any other. And therefore, the work that we continue to do to keep our citizens safe while coordinating very carefully is unlike our approaches with other countries around the world. There's a recognition that as we move forward, there will be special thought given to this relationship. But at the same time, we know that there is a significant amount of time still before we can talk about loosening such restrictions. Okay.
We recognize that Canada and the United States have a friendship that is unlike any other in the world, and we have been working together and continue to work together in a more integrated fashion than any other country. That is what the President pointed out, and I've often pointed it out myself. And we will continue to cooperate and coordinate our efforts. But the reality is that there are still many weeks to come before we can talk about relaxing the current restrictions at our borders or when it comes to physical distancing.
Prime Minister Molly Thomas, CTV National News. You said there would be a significant amount of time, I guess, to having this border discussion. What is the danger to Canada to opening that border?
We are having ongoing discussions on border issues, on supply chains with the United States all the time. We have a integrated economic relationship and a close people-to-people friendship within our countries that allowed us to move forward on closing the borders in a way that assured essential services and supplies continue to travel. We will continue to look at ways we can move forward to help each other deal with this pandemic. We recognize that it will be time still before we can loosen those border restrictions.
What is the danger, though, Prime Minister?
we recognize that there is a need to protect our citizens, as every country is doing. Most countries around the world move forward on restricting travel, and Canada and the United States are no exception.
Are you, sorry, in French?
Okay.
There are many countries around the world that have limited travel and are controlling their borders and only allowing essential goods to come in, and that's exactly what we will continue to do.
Are you concerned about retaliation at all from the Americans if we don't open on the timeline that they might want?
The coordination and collaboration between Canada and the United States on this issue and on all issues has been entirely exemplary. The reflection that the President shared was one of how close we are and how the status of the Canada-US relationship is different than the status of relationships that we have with other countries around the world. There was a recognition that we will do things perhaps differently than other countries, but there is still a recognition that we need to continue holding that the measures that we have in place for a good while to come still.
Prime Minister Janet Silver, Global News. With people dying at group homes for disabilities and Premier Ford saying that the situation in long-term care homes should be, quote, a wake-up call for the world, what is your government planning to do to support the country's most vulnerable citizens, not only now, but in the weeks to come?
Well, tonight, I will be speaking with the premiers, and we will be talking directly about how to ensure better protection for our elders in long-term care. It is impossible to imagine the anguish families and indeed our elders are going through in this situation. There is just so much fear, so much uncertainty. We need to do a better job of being there for them. The federal government is looking at ways to support the provinces as they deal with this issue. We're discussing pay top-ups for people who work in those situations because the conditions are getting more and more difficult. There are also more regulations we can talk about bringing in to do a better job of protecting our most vulnerable. I think that's what Canadians expect. Okay.
This evening, we will be talking about the need to protect our seniors. We recognize that they have particular vulnerability in seniors' homes. And we know that this is a terrible thing that they're experiencing right now, their fear, their isolation, the uncertainty. So we will and we must be there for each other. And our conversation this evening with the premiers will be about how the federal government can support the provinces in meeting that challenge, how we can support the workers in those facilities, and better support our seniors directly.
A little earlier with regards to Quebec's request for military assistance. I'm just wondering, have you received a request from other premiers specifically relating to the military for help for long-term care facilities? And what sort of role do you see the military playing when it comes to long-term care facilities?
We have received 3 requests in total from Quebec, 2 for Canadian Rangers to help out in northern and remote areas, both in Nunavik and in Bas-Saint-Laurent. This most recent request around help in long-term care facilities is somewhat different than the kinds of requests that the federal government usually gets around support for provinces, which is much more often around things like floods and forest fires. But we are, of course, working to help. We're working with Quebec to figure out how we can best help in this situation, because this is a situation that is unprecedented at many, many levels. And what we have continued to say is we will figure out how to help. We will be there for each other.
Good morning, Prime Minister. Salima Shifji, CBC News. It's April 16th today, and that was the day that your federal modeling said that there would be between 500 and 700 deaths in Canada and more than 31,000 infected confirmed cases. We're at nearly double the number of deaths. So I'd like to know what went wrong with the modeling and what does this mean for Canadians?
I think people need to understand that modeling is a framework that allows us to plan for different scenarios in the future. It is not a declaration of what is going to happen, but it is a discussion of what might happen in the coming days, in the coming weeks, and allows us to plan and prepare for it. I think one of the things we've seen over the past number of weeks is a far more severe impact on seniors' residences and long-term care centres than we had certainly hoped for, or more than we feared, and therefore we need to take more measures to protect our seniors. That's what I'll be talking with the premiers about tonight. Okay. Les modèles nous.
The modeling does not predict and does not say exactly what is going to happen. It allows us to prepare for various scenarios that could occur. And I think that what we've seen in recent weeks is that our seniors' residences have been hit harder than what we were expecting. And that is why we will be addressing that issue this evening with the premiers of the provinces and territories.
Is the Canadian government prepared for some frontline workers, medical workers, to die in the fight against COVID-19? And what would the government possibly be looking at to support family members and dependents left behind?
There have been far too many deaths already in Canada, and that's why we need to continue to do everything we can to slow the spread of this disease and to protect our frontline workers with PPE that we're ordering in, with support for them, for their families, as we get through this difficult time. And the most important thing is for Canadians to continue to stay home, to slow the spread of this virus, to ensure that those who go to work every day to keep the rest of us safe and to fight this virus are able to do so in safety for themselves and for their loved ones. We will continue to do everything we can to protect these heroes.
Bonjour, Monsieur Trudeau, Philippe Vincent Foisy de Radio-Canada.
Radio-Canada, I understand that you're in negotiations with Quebec. We understood that point, but in concrete terms, how many individuals or how many physicians or nurses can you send? I'd just like to have an actual idea of what could be offered to Quebec. Well, as I said, this is an unusual request that we have never received before, so we're looking at scenarios and different ways of helping. We will be there to help. We want to help. But what it looks like at this point, well, that's what we're talking about now. So you don't have any idea that it will be 50 doctors or no. We're discussing that right now as to how we can help. But we also know this is a very serious situation if Quebec is asking the federal government for help. So we will be there to support them, but we have to develop the solution together. When? Well, in the coming hours and days, we are having those discussions, and we know that it's urgent. So we will do this as quickly as possible so that we can send them the support they need. Thank you very much, everyone.
Okay, and that is the Prime Minister of Canada giving us his daily briefing in terms of his government's response to the pandemic, to COVID-19. Lots of news in there is going to mean, but it is a third request